There was a lot of situations that happened. Some drug use. So my wife and I separated. She got all the property and everything, and I hit the road. And I've been across this country close to 5 times in 3 years. Last night I slept outside, got caught in the rain. The other option was an abandoned house, in the woods, camping. That's always a favorite one. But
when I look at my patients, they span a wide spectrum, from former software company CEOs to people who previously worked blue-collar jobs. And I think, again, it sort of comes down to just having bad things happen in their lives, that they don't have the support system to sort of sustain that. I think that when you ask currently unhoused or unstably housed patients themselves, did you make bad choices and is this why you are in the position you're in? I would say most of them would say yes. And they are probably the hardest on themselves of anyone. But you just have to peel just a little bit under the surface and you can start to see that, yes, that there were some personal decisions that were made, but there's so many sort of social forces that were actually pushing them in a certain direction. It would have taken a tremendous amount of mental energy and also sort of social resources for them to sort of swim upstream and make the right healthy choice.
It's really hard to pinpoint just one particular cause for someone being unhoused or homeless. We do see a lot of times the cofactors, mental health, and with mental health a lot of times comes substance use. And then when we dig deeper, we're seeing a lot of unresolved trauma. That can really impact someone's ability to sustain or maintain housing.
It's expensive to live here, and then to stay housed, you really need, if you have mental health issues, to stay on your medications. So you really need psychiatric services, and then medical social work as well, and general case management.
Unless you find housing, you can't get many healthcare services. Like, you can't get a surgery done unless you have a place that you could stay in afterwards. There are folks who need refrigerated medications, including insulin, and if you don't have a home, you don't have access to refrigeration services. And being outside, not being sure of your safety and the security of where you're staying definitely takes a toll, I think, in the long term on the health of patients.
You run into health problems being homeless. I ran into dehydration in Nevada, crossing the desert, thinking I was going to cross the desert. Got rescued by the cops. They called it paramedics. I got into the ER. They discovered I had some serious issues, so they took care of me.
The emergency department is not set up to be a social services agency, but because of the issues of connecting patients to Primacare Home with social services, a lot of patients end up going back to the emergency department when something happens. And that's one of the things that we are trying to work on here, is to try to make those connections so that patients can easily access primary care services after they've been in the ED. We have about 5 doctors from Stanford who work on a part-time basis here at Peninsula Healthcare Connection. And we have a strong referral network to Stanford so that we can send folks there for imaging or to see specialists.
Peninsula Healthcare Connection is just like any other clinic, except we have a lot of special help and assistance that we can provide to our population.
The patients that we work with are unhoused or at risk of being unhoused. We're located here in the Opportunities Center in Palo Alto, and there are 88 units of housing upstairs. And so a lot of the folks up there are also considered at risk.
Our primary goal is to assess and see where they are and what their urgent needs are and how we can better assist. Our overall goal is hopefully we can get them housed or sheltered so that they can better care for their pending needs.
It sort of boils down to having a long-term relationship with patients so that they know where to go and they trust their provider and the care team.
So going out into the community and being able to just talk to people, we actually have a really awesome new tool in our toolbox, and it is a little golf cart.
So we will go to the far corners of Palo Alto and find the folks that are in the creeks and that kind of thing.
If they're reporting any type of non-emergency issue, we could bring them in the same day. If we have to get them to a specialty clinic, we can take them in our little cart and bring them over to the Stanford clinics. So that is just something that is new for us, and it's something that is really exciting because it's a game changer in terms of accessibility for our patients.
I got off the bus, asked the fella if there was any homeless shelters in the area, and he pointed me towards the Opportunity Center. And when I got there, like the first day, which was about just 2 days ago, they really got me going and told me about this shelter, and it's right now working fine.
We do have a group of patients that really see us as their Primacare home, and they come here rather than the ER because we see them. We see them when they walk into the building. We celebrate things with them. They'll drop in if there's something that's going on with their health because they know we're here. And so it's very easy to engage folks who are coming regularly by it. The more touch points you have, the trust gets built faster.
And if we hear our patients, if we hear their stories, not just listening to our patients, but hearing what they have to say, we can better really suit their treatment where they need to be and what we can do for them.
There will always be people that will enter into homelessness. Our goal is to get them back into housing and get them the health care they need as soon as possible.
If we really want to address the healthcare needs of our homeless population, or unhoused population here, we have to think about how we are also part of the solution in terms of addressing the housing insecurity issue.
We need to deal with housing and medical needs and mental health all at once. It really needs to be a team of folks working together. If it doesn't succeed the first time, don't give up. If it doesn't succeed the second time, don't give up. We're gonna push harder, and we're gonna really support patients, but we can't do that unless we continue to provide empathy for them.
Where do you see yourself in a year, Sal?
In a year? This program's 90 days. Mainly the thing is if I can get on top of my recovery and sobriety and stay like that, I can be productive in society. I can be working, having a car. In a year, maybe pretty much if I carry on in a good behavior way, I could have a place, be living in an apartment or something.
I appreciate it. Thank you very much.
Yeah, you're welcome. Thanks.
All right.